Another episode of the Wellness Doctor Network, where we connect the community to top-notch doctors. I'm Dr. Holland Meyer, along with my guest, Dr. Andrew Oteo. Thanks for joining us.
Absolutely. Thank you for having me.
You bet. So as we start this interview, can you tell us generally, what is your approach to healthcare?
Absolutely. And we take a very conservative approach to healthcare in our office. We don't prescribe medications or perform surgeries, but we do work with other like-minded doctors to make sure that patients have the best possible outcome for what they come to see us for.
That's awesome. I always love starting with conservative first, and then when drugs and surgery are necessary, then you help them along that route.
Absolutely.
So being a doctor of chiropractic, tell our viewers, what is chiropractic?
So chiropractic is there's an art, science, and philosophy behind what we do as doctors of chiropractic, and that goes along with what I just mentioned about first do no harm. That's really the Hippocratic oath of what we do as physicians, as doctors. But truly, chiropractic uses the central nervous system. It helps to open up the body's ability and wake up certain areas of the body to facilitate the healing process. Mm-hmm. And when we talk about the central nervous system, that's the brain and the spinal cord. But when you think about all those other interconnections that happen, it's really amazing to see that when patients come and see us for pain, back pain, neck pain, headaches, many times they don't mention like they're having also menstrual cramping that they're dealing with, or they're having digestive issues because they don't associate that with chiropractic. But as a cool, side effect of chiropractic, sometimes we'll actually see those things improving as well.
Right. When you take out the interference,
exactly,
the rest of the body begins to function properly.
It helps to communicate better. You're absolutely right.
Awesome. So as we get into more about you and your office and your practice, you're a chiropractor, and what makes you guys unique, or what's unique about your office?
So we have an amazing team. I like to brag on my team. Okay, so we have just amazing people here. I'm one of two doctors of chiropractic here in the office. As well, we have a doctor of physical therapy and massage therapy, and we actually are a learning institute for Parker University, which means we have chiropractic interns from Parker University that come and they learn out of our facility, which we absolutely love. And sometimes I learn more from those interns than they learn from me, to be honest with you. I love their energy. But the cool part behind that is we truly pride ourselves on the physical rehab component of that, and allowing patients not just to recover from pain, but also learn tips and techniques for not just short-term pain alleviation, but long-term correction.
Awesome. I love that. And to fix the problem, but also to help minimize or avoid re-injury.
Exactly. And that's a problem we see is, the most common thing that causes a shoulder injury is a previous shoulder injury, right? And so a lot of times we'll have those repetitive things. And we have a lot of weekend warriors that come here that want to stay active. They want to keep going to the gym or doing CrossFit, or as simple as they want to keep sewing without pain, I have a lot of patients that come in that don't necessarily want to be a world-class athlete. They just want to be able to continue doing those activities that they love.
Right.
And that's truly what we get behind, and we try to help people with doing.
I love that. And you've got you're a gadget guy.
Oh, totally. Yeah.
And this office probably has the most technology that I've ever seen in a chiropractic office, or a medical office even. And so tell us more about the examination process, the x-ray, and the cool thing about that.
Yeah, so we, in addition to having different types of software to help evaluate patients in different ways, one of the things that we really do that's unique to our office is actually what's called a functional motion evaluation x-ray.
Okay.
And so what we'll have patients do is, many times you'll notice if you're just sitting still, you may not have symptoms or the pain that you're experiencing. But if you are moving your head, or maybe you notice it when you're driving and looking over your shoulder each way, that's when you get like a pinch or a sharp pain. So what we tend to find is, if we're actually going through and evaluating the spine in a motion pattern, is where we can find those functional breakdowns that are happening, that we can quantify, we can measure those things, and what you measure, you can correct.
Right. So even with the x-ray, we're used to having it, be very, very still so we can get it. But however, you're saying that when we find our pain whenever we move, so you're doing these x-rays while we're in motion. Correct. So you can get very, very specific with the treatment.
Yes, that's where that dynamic component comes into it.
Awesome.
And so what we actually have patients do is go through a flexion extension view or lateral bending view. And through that, we can find out which segments of the spine are locked down and not moving properly. And we can also identify what is moving properly. That way we can really hone in and really kind of take a sniper view versus a shotgun approach towards chiropractic care.
I love that approach. And say you had a team. I love that you don't call it staff, by the way. It's a team effort, right?
Staff's an infection.
I love that. I've never heard that before. So with your team, you've got multiple doctors. You've got a doctor of physical therapy as well. So you've got a powerhouse team. You've got some incredible technology, not only with the x-ray process, but you've got some cool stuff to help the patients have true progress. Tell us more about how that happens.
Absolutely. And it takes a village, right? For anything, it's a team approach. And truly, that's why we try to bring these other doctors, these other disciplines that fit synergistically within our method to make sure that patients have really a well-rounded approach and a well-rounded scope. That way they don't just get Dr. Oteo, they get truly a team of doctors around them that helps them with their rehab process.
Awesome. And you have docs refer to you left and right, not only for treatment, but even if it's just for the motion x-rays.
Exactly.
That's awesome.
And that's, we try to work and again, take more of a chirocentric approach. So we do have other doctors, other chiropractors that refer to us just for the physical therapy component.
Okay.
We have doctors that refer to us just for the x-ray component.
Yeah.
But at the same time too, we have doctors that say, hey, do an evaluation, a treatment. We want to make sure that we get this thing corrected and then send back to us if there's any other things like injections that are necessary too, which we try to avoid if at all possible.
Right, because the patients are the number one priority here.
That's it,
right.
Number one.
Awesome. So I know you have a ton of success stories because you're well known in the area, but can you share a success story with us real quick?
Absolutely. If you go onto our YouTube page, you'll see all these patients that are super excited. There's a gentleman that sticks out in my mind, and he's become an amazing friend in the process. But when he first came in here, he shared with us that every morning he'd get up and get out of bed, and he had to literally crawl to the toilet. He had to literally crawl to the bathroom to start getting up and getting ready because his feet and his knees hurt so bad. And he would do that every single day. He would get up, he would crawl to the bathroom, and within 3 weeks, that took 10 years for him to finally come in. Sometimes, I don't know if you notice this, men have a little bit more trouble going to a doctor and they'll wait until their leg has fallen off before they finally take action, right? So he finally came and saw us after 10 years and it took us 3 weeks to get him walking to the bathroom. His wife came in here in tears and she said, thank you. He's been so stubborn about this. He came in here and basically now he's back to doing sports. He's running again and just doing those things that he's truly passionate about.
That's awesome. So he got his life back and his wife got her husband back.
That's right. It's a win-win. So.
That is incredible. Thanks for sharing that with us. I know you have a ton of those kind of stories. One of my favorite questions I like to ask the doctors is, what is your favorite part about being a doctor?
And with being a doctor, there's a big responsibility. And I really, truly take that seriously. But the responsibility I have to my patients is to be completely upfront with them and be completely honest and transparent to them. And what I love about that is the heart behind our facility is truly loving service. And that's loving service, if that requires us, working with patients on insurance, if that's something that requires us, helping patients facilitate treatment with another doctor, but seeing those results and really serving that patient to whatever degree possible is something that I love. Every day when we come in here, we get to meet patients and learn new stories. And I love sitting knee to knee with patients and really hearing about how I can help them and add value to their life.
At a heart level, where we can get real with people. That's so awesome. So you're one of the best doctors in the colony, North Texas actually, and you get the results. And now we know more about you, right? So then you have character and that integrity that the Wellness Doctor Network just prides themselves on. So thank you so much for joining us. Yes, and thank you so much for joining us for another episode of the Wellness Doctor Network, where we connect the community to amazing top-notch doctors like Dr. Oteo. And we also allow collaboration among the doctors in the network so that we can bridge the gap in healthcare. Thank you for joining me. I'm Dr. Holland Meyer.